With aging, the enlargement of the prostate becomes a common issue for men, and this condition is known as benign prostatic hyperplasia, or BPH. This prostate gland is directed by several hormones secreted by the testis and other organs. Many food items are known to have a significant effect on these hormones and make the situation worse for a patient with BPA. So if you are suffering from BPH and are confused about what to eat, then this video is just for you. In this video, we will tell you about some of the food items that you should stop consuming if you have an enlarged prostate. Let us get into it. Starting at number 1, red meat. The sight of a juicy steak on a Sunday morning is undoubtedly irresistible, but unfortunately, if you want to maintain a healthy prostate, you must not be lured by it. The inflammation is aggravated by arachidonic acid, and consumption of red meat raises the levels of arachidonic acid in your body. Arachidonic acid boosts inflammation in all parts of the body rather than just the prostate. So when you are dealing with BPA, avoid the foods that have an inflammatory response towards your body. Processed and non-processed red meat is known to possess some carcinogenic factors as per the International Agency for Research on Cancer. When a study was done regarding the prevalence of prostate cancer in people consuming red meat, it was found that it resulted in an increase in the development of cancer. On top of that, the eaters are having a 30% higher risk of developing the advanced stage. You can obviously change your steaky Sunday to a fishy Sunday. How about going for a fish stew or a creamy salad with trout? The dietary nutrients of red meat can also be replaced by beans, which are high in fiber and protein and help the body in other areas as well. Number 2, sugary foods. Sugar is also known to boost the inflammatory process. Carbonated fizzy drinks and pastries have a great deal of sugar in them. Along with this, sugar is also added to processed food items to give them an added flavor. So to keep your prostate healthy, limit the number of sugary foods, which will consequently reduce the pressure on your prostate. Obese men and men having raised sugar levels are at a high risk of developing BPA. A study showed that men with hyperglycemia developed BPH thrice as fast as normal men. Apart from having an inflammatory effect, hyperglycemia results in the release of insulin. Being a peptide in nature, it increases the peptide concentration of blood, which boosts the proliferation of cells and consequently results in the growth of the tumor. Everyone is aware of the fact that fresh food is the best food, so go for a change and cut down on processed and try to consume fresh fruits and vegetables. They will not only help your prostate, but the nutrients in them are beneficial for your whole body as well. Number 3, alcohol. The urinary bladder is totally composed of muscles, and we all are aware of the ill effects of alcohol on the muscles. Some of the common side effects are the weakening of muscles, which makes it so difficult to control the bladder muscles, and dehydration. The difficulty in controlling can result in an increase in frequency, and sometimes urinary leakage may also occur. Alcohol can affect the bladder in the opposite way as well. It may have a stimulatory effect on our nerve cells and make the muscles of the bladder overactive. Being a diuretic, alcohol increases the frequency of urination, which may be a great issue for people having an enlarged prostate. The increase in urination may result in a lot of fluid loss, which can deplete magnesium reserves. The person may also suffer from nocturia. The inflammatory properties of alcohol may aggravate the process of inflammation and may result in an even larger prostate. Number 4, dairy products. Being loaded with calcium, milk, and milk products are known to be one of the worst foods for an enlarged prostate. The negative effects can result from high hormonal levels, milk fat, and high calcium levels as well. Other studies show that men who did not put a pause on their dairy products, even after being diagnosed with BPH, later were diagnosed with lethal prostate cancer. Dairy products are packed with inflammatory substances and saturated fats, which can worsen your present situation. However, people who love to have milk can change into soy milk or almond milk or coconut milk, which till now does not prove to be dangerous for BPH patients. They are easily available at your nearest markets. Go and give them a shot. Number 5, spicy foods. Although they don't have any direct effect on your prostate, they can cause irritation to your urinary bladder. This may also increase your urge to urinate, and you may not be able to hold your urine till you reach the washroom. The irritation caused to your bladder can further deplete the condition of your prostate. Even though they affect it, the exact reason is still unknown to us. I know it is a piece of very sad news for spice lovers, but your health comes first. Try having a little less spice in your foods, and if you still miss that old spice, try adding more herbs and vegetables. I am certain you are going to love it. Number 6. Eggs and poultry. What do you have in your breakfast? Scrambled eggs or boiled eggs? Well, if you are having an enlarged prostate, you cannot have any of them. I know it is a piece of very bad news for the egg eaters, but you need to decide for yourself. Your taste buds are more important or your health. A study conducted in 2006 explained the relationship between the consumption of eggs and prostate health. The research said the consumption of eggs seemed to aggravate all the symptoms of BPH. As said earlier, arachidonic acid boosts the process of inflammation, and this acid is found in eggs at very high levels. Therefore, eating eggs can increase the level of arachidonic acid in the body, which in turn fuels inflammation. Well, you do not have to cut down on your eggs and chicken, but limit the quantity. And the portion of nutrients can be fulfilled by vegetables as well. And lastly, number 7, caffeine. Caffeine is pretty much common in our daily lives and acts as a stimulant. It is mostly found in beverages like tea and coffee and food items like beans and cocoa. Some of the medications and energy also contain a substantial amount of caffeine. It stimulates one of the major systems of the body, that is, the central nervous system along with the heart and muscles. Apart from increasing alertness and concentration, it can make the situation of your enlarged prostate worse. It also aggravates inflammatory reactions and makes it difficult to urinate. Just like alcohol, caffeine is also a diuretic that increases the frequent urge to urinate. Lastly, it also increases blood pressure, which in turn worsens the conditions of an enlarged prostate. Well, you obviously cannot cut down your caffeine intake in one day, so make a slow start, and every day increases the amount of caffeine that you are cutting down. Switch to a decaf version and limit the intake of caffeine. Now let us tell you some of the foods that you can help with in this situation. You keep your condition under check, you need to consume a lot of fruits and vegetables. Next, you should not be sitting and sulking over your condition. Rather, get out there and make your body sweet. If you stay active, it will help you to decrease inflammation. As known that obesity is a risk factor for BPH, exercise can also prevent weight gain. Stress can also contribute to making enlarged prostate worse, so speak out about what is bothering you and relieve yourself. Finally, you need to drink a lot of water, as improperly diluted urine can cause a lot of irritation to your bladder. So with this, we have come to the end of this video. The treatment of this condition has a very broad spectrum, starting from lifestyle changes at home to surgery as well. See a doctor if you notice the sign and symptoms of BPH and carefully follow all the instructions. Stay in touch with your physician in case of deteriorating conditions. And if the home remedies are not helping, the course of treatment may get changed to medication and finally surgical procedures. So with this, we have come to the end of this video. If you like this video, share it with your friends and family who are suffering from this condition. Don't forget to subscribe to our channel for more such related videos. Hit the bell icon for fresh updates. Thanks for watching.